Expatriate health insurance and other advice for expats moving to Asia. Health risks, medical facilities, and expatriate health insurance covers vary in different parts of the world. Moving to another country involves such critical issues, and some awareness in these matters is an added advantage. In Asia, for instance, the biggest risk is not malaria, hepatitis, or bird flu, but in fact, road accidents. If you are moving to Asia in the future, then here is some health advice. Health risks. Awareness about the health risks you could encounter in the region is the first step to ensuring your own well-being. If you are wondering what the biggest health concerns for travelers and expats in Asia are, then here is what health experts have to say. Stress-related problems, jet lag, and respiratory diseases are primary concerns for business travelers, while respiratory infections, traveler's tummy, diarrhea, endemic infections like dengue, malaria, bird flu, hepatitis A and B, and swine flu are other health risks. The overall health risks tend to be higher in rural Southeast Asia. Medical kit. Preparation is the key to tackling health risks, and your own medical kit is an absolute lifesaver. Include common treatment for fever, cold, chest infection, diarrhea, pain, and wounds. Those with a medical history must include prescription drugs together with an authorization letter for any tablets that have to be carried. Besides this, what you need to include in the kit depends on your medical status and where you are going. Women may need to add some additional medication for problems like thrush and contraceptive pills to regulate their period. Immunizations. Start your vaccinations early, preferably 8 weeks before you travel. Most doctors recommend vaccinations against hepatitis A and B. A meningitis ACWY vaccine is advisable if you are going to be in close contact with the locals in areas where meningitis is a common problem. Tuberculosis, rabies, and diphtheria are other diseases for which you may need immunization depending upon what part of Asia you are moving to. Anti-polio vaccinations for children below 18 is highly recommended. Coping with weather conditions. Heat, dust, and humidity are common weather conditions which could lead to health concerns. Wear loose, full-length cotton clothing, a broad-rimmed hat, and apply sunblock to protect your skin from the harmful effects of the sun. Drink at least 8 glasses of water a day to stay hydrated. Wear a nose mask to protect yourself from dust. Road accidents. If you thought the biggest health risks in Asia are dengue, malaria, and the bird flu, then here are some statistics which could be startling. The Asia-Pacific region has only 16% of the world's vehicles, but accounts for 60% of the world's accidental deaths. Using common sense and restraint while walking, crossing streets, and navigating traffic are some ways to prevent road accidents. Given this scenario, the importance of accident insurance cannot be overemphasized. Avoid insects. Mosquitoes and bugs are responsible for the spread of most infectious diseases, which plague the region. Sleeping under a mosquito net, use of mosquito repellent, and regular pest control are some important preventative measures, which if taken, could ensure you have adequate protection from the mosquito menace. Food and water. Drink bottled or boiled water at all times to prevent waterborne diseases. Clean hands and clean utensils with hot, freshly cooked food at the table is what you will need to stay healthy. Wash and peel fruits and vegetables yourself. Asia has an array of street food, and you may be tempted to succumb to its many tastes and aromas. Steer clear of this temptation, for it is often the surest way of attracting tummy trouble. Avoid undercooked poultry and local delicacies like sushi to keep parasitical infections at bay. Use a hand sanitizer to keep hands clean, or simply wash frequently with soap and water, especially before eating and cooking. Insurance cover. Some research on what your international expat health insurance covers and excludes is imperative so that you know exactly what to expect if there is a problem.